Hi, Gabriel. Thank you for making time for today's conversation. We could start with you telling us a little more about your background and your role in the region.
Thank you so much, Sasha. I am the regional health advisor for UNICEF in Eastern and Southern Africa. With the regional team, I do my best to support 21 countries, and we do that supporting governments together with partners and civil society organizations, advocating for children's rights and making sure that the health services that our children and mothers get are the best we can possibly deliver.
And in this current situation, you've also seen firsthand what the impact of the coronavirus has been on the region.
Indeed, over the last 5.5 years, I've been able to travel to almost all the 21 countries more than once and see the situation on the ground. We have been struggling because we have an increase of the population that is around 2.5 every year. But we don't have a similar increase in health budgets or number of health professionals. And so we've seen the number of unimmunized children increasing 1% every year, for instance. Or we've seen health systems struggling to deliver the most basic services to their population. Even before COVID, we were saying the MDGs, the Millennium Development Goals, had been a success story in health. We managed to reduce under 5 mortality quite a lot. And then COVID came. And COVID doesn't affect children much. At the same time, the containment measures for COVID is what has affected children greatly in our region. If you think of the closure of schools for more than 1 year, our experience with Ebola in West Africa a few years back tells us that when children stay out of school for a few months, many of them tend not to go back. And that's a big issue. We are losing more than one generation in this process. And then something that might not be immediately evident to people that are lucky enough to live in more developed countries. Many children get their main meal at school at lunch. When the school is closed, we see malnutrition of children increasing. We see adolescent pregnancies increasing. We see violence against children increasing.
The surge that's now happening in countries in Southern Africa. In fact, WHO has recently indicated that Africa is now in its third wave. Could you tell us some of the reasons you think are behind this surge?
When you look at the southern part of Africa, South Africa, Botswana, Namibia, Lesotho, Eswatini, they're already low middle income countries. They have an epidemiological situation, meaning a profile of the population that is not too dissimilar from Europe or North America. What does that mean? It means that we have more obesity, more hypertension, more diabetes. And also the age of the population is a bit older. So when you look at the mortality by 100,000 people in this part of the continent, it's even higher than India. It's very similar to Europe. And what is different from the previous waves is not only that this wave has been bigger, but that in many countries is not ending as it tended to end before. Now, when you move to the east part of Africa, most countries have a much younger population than in the southern part of the continent. And we've seen this third wave going from the south to the east part of the continent. So we're seeing now cases going down in the south, but in the east cases are going up. We will not probably see as much mortality because the population is much younger. At the same time, all the containment measures have been put in place and schools have been closed again. So what happens is that children are not going to school, but they're contributing in a small amount, but they're contributing to community transmission. They are in multi-generational households. They are living in slums or in areas that have high population density. So closing schools does not prevent much of the outbreak, but comes with a very high toll for children.
So could you tell us a little bit more detail about what UNICEF is doing to support and protect children in the region?
We are the agency that mobilizes and manages, procures and supplies billions of doses of vaccines every year for routine immunization, and now also for COVID. But I think most importantly, what we have been doing all along, and we're doubling down now, is ensure that children's rights are fulfilled. And when it comes to health, that means that the basic health services are still available for children. It's also about education, it's also about child protection, it's also about availability of water and sanitation. And all these are areas where we are very active, country by country, trying to find ways to deliver services for children.
So we've all been living in this pandemic, taken not just a physical toll, but mentally as well. How are our colleagues in the region doing in coping?
Give me a second. Yes, UNICEF has not been spared. We are losing colleagues, losing relatives. In the countries where we operate, we don't have vaccines. When you think of, again, Europe, Asia, North America, with the objectives of getting by September with enough people vaccinated to contain the outbreaks. And then you look at our region where we have 2% of people vaccinated, and we're still struggling to secure vaccines. And that's a huge inequity. And it touches us too, because as UNICEF staff and our families, many of us still have not access to vaccines. And when you see your colleagues dying when they could have been vaccinated, it's not easy. It's not easy at all.
Really, our hearts go out to you and our colleagues in the region, and really our colleagues in all country offices. Everyone has been doing so much professionally while managing things personally, and it's been a tough 2 years, really.
Now let me touch on the flip side of that. The fact that we could not physically reach people and do capacity building and support, we started doing it virtually. And in the last year, we managed to train in quality of neonatal care more midwives than we did the year before. So as UNICEF, we've found ways to still deliver, to still support, to still improve the situation on the ground. But the challenges are huge.
As UNICEF, with our partners, what are the one or two main things that we can do to bring this pandemic situation under control in the region?
One is we do need a concerted and harmonized effort that comes with technical capacity, resources, and coordination to make vaccines available quickly and to deliver them to the population groups that are most at risk. So as soon as we have the risk groups vaccinated, keeping schools open will be less of an issue. Keep health facilities providing essential services and not being swamped or re-geared only towards COVID will be feasible. So any support in that direction is more than welcome, obviously.
Thank you very much, Gabriel. This conversation has been truly enlightening, and it has been good to have this honest chat with you. We really appreciate your time. Thank you very much.